Osteitis pubis is an inflammatory condition of the symphysis pubis. If you think back to your anatomy, you have an articulating disc at the symphysis pubis. You also have inferior and superior ligaments that hold it together, and this is the site of abdominal and hip adductor attachment. So if you have excessive movement at the area, it can irritate any of those structures. Mechanism of injury includes rotation or shear stresses, such as ball kicking that you'll see in soccer or rugby or football. It may include abduction, external rotation activities that you see in soccer or rugby, or my favorite, the famous race walking. It also includes mechanisms related to DIF and direct trauma. Really, there is little to see with this condition. You will find direct tenderness over the symphysis pubis. The pain may radiate into the lower abdomen and adductor mass. The person may have a waddling gait, and they may complain of difficulty with running, sit-ups, and squats. There will be a decreased active and passive range of motion for hip abduction and flexion. And when the person performs a pelvic tilt, it increases the pain. There are several special tests that you can perform for osteitis pubis. You can use the Thomas test. The Faber test is placing the person in a cross-legged 4 position and putting pressure on the knee and the opposite hip and seeing if that spreads that pubis symphysis. You can also perform direct compression tests or lateral compression tests, which will squeeze the pubis together as well as spread it apart, recreating pain. Diagnosis will include bone scans, CT scans, and an MRI, and the MRI is going to be used for the hip adductors and to look for abdominal injuries, but basically we want these to rule out stress fracture.